Hey guys, so my name's Stephanie, and I'm a fourth year at Case Western Reserve School of Medicine, and I'm going to be talking to you guys about what's in a patient's room. So we're going to start with sort of what's outside the door to your patient's room. It's really important to make sure you note if there's any signs or precautions before you enter a patient's room. In this lovely picture, we see a nice stop sign that says you need to be wearing a mask, some gloves, and a gown. And so if your patient's room has any sign like this outside, it's okay to go grab the nurse and ask her what you should be wearing. But also, you can find that stuff usually outside the door to your patient's room. So look around. Sometimes there's a cupboard, or sometimes it's on the door itself. And you can find your gowns, gloves, masks. Also, you can look outside. Sometimes there's a cupboard that has things like gauze pads, alcohol wipes, things like that that you also might need, and that's a good spot to look. Alright, so if your patient sign has it, or if your patient's door has a sign, go ahead and get that stuff. If not, you can feel free to knock and enter, and now we'll talk about what's inside the room. So in this picture, we have a nice example of a standard patient room. And so we have a few key things. We can see the patient's bed here. We see that they have this table that usually goes over their bed, and a lot of times they'll be next to their bed or over it, and that's what they eat on or store their belongings and their food and things like that. You can see over here we have our sink, so it's really important that you wash your hands before you get into your physical exam. All important for our patients is their TV. It will most likely be on in any patient's room that you enter. So make sure before you start talking to them that you ask them if you can turn it off or turn it down, because a lot of times it's hard to do an exam while your patient's watching the TV. Some other things that you want to make sure you identify in the room is the monitor. In this room, it's here. It's not on. I'll show you an example of that later. But this is where you can locate your patient's vitals and actively check them to see if there's anything that you need to write down for your patient. If you do any procedures with someone or use any sharps, there's usually a sharps box somewhere on the wall that you can locate. Sometimes your patient might be hooked up to oxygen, and usually it's kind of hard to see in this room. I think they're over here, but usually it's behind the bed, and the tubing will be connected to somewhere in the wall where they have the oxygen outlet. And we also want to make sure we know where the IV stand is. I actually think in this room there might not be one. And of course the light switch. You want to make sure you have your lights on when you're examining the patient, even though they might be a little groggy in the morning when you come in and wake them up. It's better for you to be able to see what you're doing. Alright, let's look at another example. So in this room you can see that there's two beds. So sometimes our patients aren't privileged enough to have their own room, and so there might be two patients or more to one room. So make sure you know which one's 1 and 2 and which one's A and B, or however they're labeled, and which one your patient's in. And usually it says it above the bed, or whichever one's closer to the door was probably number 1. So if your patient is in a room like this and you're coming into exam, there's a lot less privacy in a room like this, so make sure that you look for the curtain and that it's closed. Okay, so this is the privacy curtain here. And also, sometimes again, to help with light, we can see in this room, there's an overhead lamp here that you can usually turn on with a light switch that's above the patient's head. So sometimes it's by the door, and sometimes it's above the patient's head, so you want to make sure you turn that on. And of course we have some sitting space here for either your patient or their relatives to be in. Alright, so we have another example. I like this example because this hospital room definitely has the best view out of any of the other rooms that I've seen, and has a lot of family space. So you might see nice pretty rooms like this if you do rotation in Seidman Cancer Hospital, where the rooms are very large and they have lots of space and they're very pretty, a little different than some of the other rooms. And again, here we can see the patient's monitor. We can find the oxygen outlets here, some light switches. We can see our overhead lamp above the patient. We see our table that's over the bed. And we have a nice little teddy bear here. All important in this picture, I think. All right. So I have one more example to show you guys. In this picture, I wanted to just highlight the remote control for the patient's TV. It also has their call button usually so that they can call their nurse, and a lot of times patients lose this remote, so you want to make sure that you find it for them or put it back next to their head or near their hands so that they can reach it if they need to call their nurse. And also you can control their TV with it, so you'll be able to turn down the volume or turn it off if you're coming in the room to examine them. All right. So two more quick things I want to tell you about. One is the monitor screen. So this is what will be displayed on the monitor above your patient's head. And I wanted to tell you what the different colors and the different numbers mean. So starting with our green line here, that's the pulse line. So if you follow that across, you can see the patient's heart rate. And if you look at this, it kind of looks like your typical EKG lead. So that's what we're using to measure their heart rate. If we look at the blue line here, that's their respiratory line, and you can see their oxygen saturation, and they're at 100% in this patient. This white line, this will tell us their respiratory rate. So we follow that across, we get 28 is the respiratory rate, and then looking down here at this pink box in the left-hand corner, this is going to tell us the patient's blood pressure. So their pressure is 107/52. Two important things I just want to say is that if something looks really weird here or it's not reading, just check your leads first. A lot of times the patients will be moving around and they'll lose their monitor for the oxygen saturation. It falls off their finger or whatever, or an EKG lead falls off. So always check that first and then look at the reading to make sure that what you're looking at is accurate. And then the last thing I want to tell you guys about is the IVs in the patient poles in the patient room, and they usually have lots of medications or fluids running, and you'll find this next to their bed. One thing that I think is hard is that when you go in to talk to your patient, a lot of times these might start beeping, either because there's air in the line or they've finished running. So I don't like to mess around with these because I don't exactly know how to use them. But one thing I do know how to do is press the silence button. So usually the silence button is somewhere here. So you can press that, try to get through your exam to talk to your patient, and then page their nurse or have them call, and they usually will be able to come in and remove the medication because that's really their job. So I don't think it's our position as the medical student to be messing around with the medications that the nurse is hanging for your patients. Sometimes also if it's just like an air bubble or clogged, you can try moving the line or hitting the resume button, which is usually above it. So that's pretty much all the things in a patient's room, and I hope this helps you out.